Totally implantable wireless blood flow monitors are used to give a clinician information about blood flow in a vessel without expensive bedside equipment. The current gold standard for monitoring blood flow in free flaps has the patient tethered to a bedside monitor by a transcutaneous wire, which can dislodge or damage the vessel if snagged. Additionally, these bedside monitors require experienced operators to interpret the blood flow results. Reported implantable wireless blood flow monitors are bulky and not intended to operate alongside multiple monitors, such as when monitoring multiple vessels in a free flap transplant. This research presents a totally implantable wireless blood flow monitor system that ameliorates the problems found in current wireless blood flow monitors, namely through increased implant size reduction and a simple and easy to interpret real-time output that doesn't require experienced operators. The system is comprised of a battery-powered wireless implantable blood flow monitor. The external computer controls a transponder that turns on and communicates with the implanted electronics. The blood flow data wirelessly collected from the implant is displayed as a blood flow waveform for real-time viewing on the computer screen. Compared with other implantable wireless blood flow monitors, the implanted electronics in our system are the smallest reported in literature, approximately 1.7 cubic centimeters without encapsulation. A small implanted package reduces bioburden. The system was benchmarked using a syringe pump, which is accurate to within 1%. Flow rate and velocity were computed from the spectrogram of the measured blood flow signal. The measured performance showed a relative error less than plus or minus 5% above 8 milliliters per minute, and about plus 1.2% to minus 0.8% at its upper benchmarked flow range. To the best of the author's knowledge, this accuracy is the lowest reported in wireless implantable blood flow monitor literature across its benchmarked flow range. We collected blood flow from the bilateral femoral veins of 4 swine. Our blood flow collection protocol involved monitoring blood flow for 1 minute, then manually tightening a ligature around the vein to occlude for 1 minute, followed by releasing the ligature completely to resume flow for another minute. Each femoral vein was monitored using this protocol 4 times, for a total of 32 data collections. The results of this data collection showed flow waveforms with an average amplitude standard deviation 3 times greater than that of the occlusion case. Establishing the baseline flow waveform amplitude compared to the occluded waveform amplitude simplifies interpretation for operators and provides an easy-to-interpret indicator for vessel patency. The high false positive rate found with the gold standard in free flap monitoring, particularly in the peripheral veins, can be reduced using the system developed in this research, which eliminates the problematic wire tether.